My name is Emily Allison, and I serve as Chief Strategy Officer for Seneca Family of Agencies. Seneca is a nonprofit that has helped children and families through the most challenging times of their lives for more than 40 years. We provide comprehensive behavioral health, education, and child welfare services across 19 counties in California. One of the most crucial ways we do this is through our mobile response services in 3 counties, which responded to over 1,400 crises by phone and in the community last year alone. For over 25 years, our mobile crisis teams have helped young people and their families navigate profoundly difficult moments. We were there for Anna, an 11-year-old foster youth whose grief, loneliness, and separation from her family had become so overwhelming that she began talking about wanting to end her life. Working with Anna and her resource parent, our bilingual clinicians helped stabilize the crisis at home and created a plan to support her safety and connect her to ongoing care. Our team responded to Nina, an 8-year-old girl whose trauma from witnessing extreme domestic violence was triggered during the school day, leading her to hide under a desk, scream, and strike out when adults approached. Using play, patience, and trauma-informed support, our team helped her feel safe enough to re-engage and worked with caregivers and school staff to plan to reduce future crises. And we were there for Damien, a 13-year-old foster youth whose caregiver feared the placement was about to disrupt after repeated nighttime conflicts, threats to run away, and escalating emotional distress. Our team helped de-escalate in the moment, supporting both Damien and his caregiver, and built a plan that made it possible for him to stay safely in the home, while his child and family team developed a longer-term plan. I'm here today to advocate for kids like Anna, Nina, and Damien, and to strongly urge the legislature to reject the proposal to make mobile crisis an optional benefit. This vital service connects young people in crisis with teams of highly trained professionals who can respond in the community, de-escalate safely, and connect youth to the care they need. Children are not just small adults. Their crises are different, their developmental needs are different, their family dynamics are different, and their service systems are different. Guidance from SAMHSA and the American Academy of Pediatrics clearly states that effective response for children requires specialized teams that understand youth development, caregiver and family engagement, school and child welfare systems, and how to stabilize a crisis in a way that protects long-term well-being. If this benefit is made optional, counties will have a much harder time sustaining specialized children's teams, let alone with 24/7 support. And in many places, especially rural counties where these services are needed most desperately, mobile crisis teams may completely disappear. That would be a devastating loss. We should be moving towards more community-based, specialized, and developmentally appropriate crisis response for youth, not away from it. This proposal would also have a direct impact on foster youth who receive mobile response services through the Family Urgent Response System. Last year, 23% of Seneca's mobile response services were provided to FERS-eligible foster youth and former foster youth. Seneca is the FERS provider in the counties where we provide mobile response. This is not coincidental. The integration is what makes the model work. FERS funding on its own is not sufficient to sustain the infrastructure and staffing required for 24/7 community-based crisis intervention. If mobile response is made optional, FERS will be impacted too. For foster youth and caregivers, that will mean less support in critical moments when a young person's placement stability is at risk. We know that mobile response works. It's a proven prevention strategy. In Seneca's longest-standing mobile response program, we stabilize 86% of young people who receive an in-person visit, diverting them from a potentially traumatic ER visit, inpatient psychiatric care, or law enforcement contact. We also provide follow-up support, connect youth to ongoing services, and help them step down from higher levels of care, often for 30 to 60 days following the initial crisis or referral. This is one of the most important prevention tools we have, reducing reliance on settings that are more restrictive, more disruptive, and more expensive. Cutting mobile crisis response does not eliminate crisis. It just shifts the cost and management of behavioral health crises to county systems who are already struggling with the financial constraints already discussed today. It also shifts the cost and management to resource-stretched law enforcement agencies and emergency rooms that are designed to address acute physical health crisis. California has made such extraordinary progress building out this critical part of our community-based crisis continuum, and we cannot go backwards now. I respectfully urge the legislature to reject this proposed change and maintain the statewide mobile crisis benefit. For young people and foster youth in particular, mobile response is not optional. It's one of the most effective and important programs we have in California. Thank you.